we have amongst us Dr. Sunita Gupta. She has done her MBBS and MD from AIMS. She's a senior consultant for Obs and Gynae. She worked as an infertility specialist in London and an endoscopy specialist in Germany. She's a gynae endocrinologist and has over 30 years of private practice, and currently she is at the Rosewalk Luxury Hospital. Today, she will be sharing her thoughts on menopause as a true menace for women in leadership roles. Dr. Sunita, the floor is now yours.
Thank you. Happy Women's Day to everybody. Can you hear me?
Yes.
Today, my topic is wellness challenges in women and with special interest in menopause. So, can you change the slide, please? Yeah, so I'm Dr. Sunita Gupta. I'm Dr. Sunita Gupta. I'm a senior consultant, Obs and Gynae with Rosewalk Luxury Hospital, New Delhi. Today, I'm going to talk about menopause. I'm so glad that we are holding this webinar because this is getting credible information is very important for women. 46% of the women didn't feel prepared for menopause because they didn't know what to expect, with what happens, is it a problem, is it not a problem, or what. Next, please. So the estrogen hormone levels keep on declining as one ages. And that is what causes menopause. When the estrogen is absolutely low, then menopause is there. And perimenopause, there is a roller coaster of estrogen and progesterone hormones. When the periods stop for 1 year, it is called menopause. And before that, it is perimenopause when there are fluctuating levels, and it can last for 2 to 5 years, the perimenopause. These are the various symptoms of, next slide, please. Yeah, these are the various symptoms of menopause, which I'm going to discuss one by one. Next. Next slide, please. Yeah, so menstrual changes can occur during menopause because the estrogen and progesterone hormones are fluctuating quite a bit during the perimenopause phase. The ovulation may or may not occur. Cycles may become quite irregular. They may be scanty, they may be heavy. The periods can come in 3 months, 6 months. And normally, and if it settles, if the periods don't come for 1 year, then we call it menopause. Vaginal changes are experienced by 70 to 80% of the women. There is dryness in the vagina. It can become like, earlier if the vaginal epithelium is like a spongy foam, later on it can become thin like paper. There is reduced blood supply, pH changes are there, change in the microbiome of the vagina. That's why it becomes more prone to infections, reduced glycogen levels in the vagina. Frequent urination can be a symptom, and women become prone to UTI because the vaginal lining is so thin. Hot flashes are the commonest symptom of menopause. They are experienced by 70 to 80% of the women. Hot flashes may be accompanied by night sweats if they occur at night. And they peak at 1 year after the last menstrual period. They can last up to 6 months to 1 year, sometimes even 5 years. And we don't know the cause of the hot flashes, but the resetting of the thermostat in the hypothalamus in the brain is supposed to be one of the reasons why hot flashes occur. The thermostat is not working properly and it feels as though the body is cold. So, it heats up the body, and then when the body heats up, then it tries to cool it up. So there is alternative feeling of feeling too hot and then feeling of too cold, and is accompanied by anxiety and palpitation sometimes. In some women, it can get triggered by taking alcohol or by smoking, or even caffeine intake can precipitate hot flashes. Treatment is by giving estrogen replacement therapy or phytoestrogens. So 30% of the world's population suffers from migraine, and 85% of them is women. So women who suffer from migraine are likely to get more migraine during menopause. And normally OCPs, that is the oral contraceptive pills, are contraindicated in migraine patients because they can aggravate the migraine. But HRT, which is also a combination of hormones, similar hormones, estrogen, progesterone, but that is allowed in menopause because we are giving dermal estrogen, and that doesn't increase the incidence of seizures and migraine. Insomnia and sleep disturbances are very distressing symptoms which are faced by women, and normally they can fall asleep easily, but then they have difficulty in staying asleep. And it can be experienced due to other issues also, like sleep apnea, aches and pains in joints and bones, frequent getting up to pee, and hot flashes, like, if you're feeling hot, you remove your cover, then you start feeling cold, and you again cover yourself. So that, disturbs your sleep. And women entrepreneurs, as it is, are busy people, and then if you don't get enough sleep, that becomes a big thing, and it can even aggravate your headaches and all that. Weight gain is experienced by all women, and it is because the metabolic set point gets changed in the body. The and the redistribution of fat happens. Earlier, if you were putting on weight in your bum, now you will put on weight in your tummy, and this excess fat produces a little bit of estrogen. So your body is trying to compensate for the less estrogen by putting on fat. And so even if you're following all the weight, exercise and diet regime, still people put on weight, and it is a bit difficult to shed this weight also. But estrogen, if we give HRT, some amount of weight can be lost. Osteoporosis goes undiagnosed in many women. It is a manageable risk. And because if there is adequate calcium in your diet, and you take vitamin D supplements and do some weight bearing exercises, osteoporosis can be kept at bay. But if there is strong family history of osteoporosis, then, or if there are bone pains, then better to get a DEXA scan to diagnose the disease. And hormonal or non-hormonal treatment can be provided to the patient. That has to be customized according to the patient's history and medical history and problems. And reduced libido, painful sex, incontinence are certain taboo topics which women are very shy to discuss. 80 to 90% have less libido. And this happens because testosterone levels fall in some women more than in other women. And especially if you have a surgical menopause, then testosterone levels are likely to fall more. And all women can take vaginal estrogen. It is very safe. It doesn't get absorbed. If you check the estrogen levels before giving vaginal estrogen, and then after in the blood after giving vaginal estrogen, the levels are the same. So there is no fear in giving. All women can take vaginal estrogen, and we give it initially for daily for 15 days, and then we give it bi-weekly and you can take it for the rest of your life. It will help in mild incontinence as well. And some women, they become very uncomfortable during pap smear. They find it very distressful and hurting. So we give them vaginal estrogen for 7 to 10 days before taking the pap smear. Mental health issues, though Sushma ji is going to talk about it, I thought I will just touch upon it. It is, a lot of women face anxiety, rage, and, can't drive anymore, and so many problems, and it affects their career basically. So it's like a prolonged PMS, irritability, and it happens more in women who have history of PMS, who have history of mental problems, depression or panic attacks in the past, then they are more likely to face these problems during menopause also. And workplace, what happens that as you go up the ladder, management ladder, you become more and more isolated because more men are there. The ratio is probably 10:1 at the level of board directors. So it is very important to create awareness about menopause, so that there is so that you get support from the workplace and from your family during menopause. And the treatment is by diet changes. Everybody, I think, nowadays is aware of these diet recommendations: fresh food, organic food, superfoods, fruits, nuts, plant-based diet, Mediterranean diet, then anti-inflammatory diet, reduce refined grains, reduce refined sugar, refined meat, avoid packaged food, avoid fast food, avoid deep fried food, and lifestyle changes like exercising regularly, reduce caffeine intake, reduce alcohol, quit smoking. Kegels exercise also, I think quite a few women are aware. Otherwise, you can ask your gynecologist to teach you how to do Kegels. Supplements can help. B6, B9, B12, and DHA, omega-3 can help to a certain extent in preventing Alzheimer's. So these supplements, and if you take care of health during menopause, this will determine how your health is going to be later on. So it's better you look after your body during this time, so that um, you are. And vitamin D supplements are required for avoiding osteoporosis. Self-calming skills like yoga and meditation may help if there are certain mental issues like anxiety, depression. Hypnosis, CBT, they also work. Hormonal treatment can be offered if diet, lifestyle, exercise, and supplements are not working. Then hormone replacement therapy can be given. We give estrogen alone if the patient has had hysterectomy. If the uterus is there, then we have to give estrogen plus progesterone, because progesterone is either natural progesterone or Mirena can be given, which will protect the uterus from uterine cancer. And estrogen and progesterone combination can lead to clotting. It can increase the incidence of clotting, especially if the woman is a smoker, and if she's overweight, her BMI is more than 25, then chances are that she might have a risk of clotting. That's why we prefer dermal estrogen. Dermal estrogen comes in the form of a gel, which you apply on your upper arm and just rub it. And so it doesn't go, it bypasses the liver. And so it is safe, doesn't increase the incidence of clotting, doesn't increase the cardiovascular risk, and it is a much safer estrogen. So phytoestrogens can be given, but not all women can have the enzyme to convert phytoestrogens to estrogen. The risks of HRT are clotting, like I just said, it can increase the clotting if estrogen and progesterone are given together. CA breast incidence is not increased if you give estrogen alone. It is increased if estrogen and progesterone both have to be given, but only a very nominal increase is there by 0.4%, so which is still a very small risk. Cardiovascular risk, if the woman is taking HRT within 10 years of her last menstrual period, if she is less than 60 years of age, if she doesn't have history of clots in the family, if there is, she's not obese, she's not a smoker, then the risk of cardiovascular events is not increased by giving HRT. So this was